Hey everyone, welcome to the start of your EMT journey with us here at ARES. This is where it all begins, the foundation of what it means to be part of the EMS world. Over the coming weeks, you're going to learn skills that save lives, make a difference, and build a career you can be proud of. But before we dive into things like bandages and backboards, we've got to understand the bigger picture. This first chapter, EMS Systems, is all about the who, what, and why of emergency medical services. Who are the key players? What are our responsibilities? And why does EMS work the way it does? By the end of this session, you'll see how EMS isn't just about responding to emergencies. It's about being part of a system that keeps our community safe and prepared. So take a deep breath, get comfortable, and let's kick things off. You're about to join a team that's as rewarding as it is challenging. Ready? Let's get to it. All right, let's talk about what we'll cover tonight. These National EMS Education Standard competencies lay the foundation for everything you'll do as an EMT, and we'll break them down into a few key areas. First, we'll focus on preparatory. You'll learn how the EMS system works and how to keep yourself safe while helping others. We'll also dive into the medical, legal, and ethical issues you'll need to understand to provide care confidently and professionally. Next, we'll look at EMS systems. We'll cover the history of EMS, where it started, and how it's evolved. You'll learn about your roles and responsibilities, what professionalism means in this field, and how we constantly work to improve the quality of care. Patient safety will be front and center. Everything we do connects back to keeping patients safe. Then, we'll explore research. You'll see how research drives the decisions we make in EMS, from protocols to treatments. We'll touch on data collection and show you how evidence-based decision-making shapes the way we deliver care. Finally, we'll look at public health. We'll discuss how illness and injury prevention can reduce emergencies before they happen, and how understanding these principles can help you serve your community better. By the end of this evening, you'll have a clear understanding of the competencies we'll be building on throughout your training and how they'll shape you into a strong, effective EMT. The textbook is your go-to resource for this course, so we'll look at how it lays the foundation for everything you'll learn. We'll also go over what's expected of you, not just in this class, but the steps you'll need to take to become licensed or certified as an EMT in most states. From there, we explore the different levels of training. You'll learn how first aid, EMR training, and the DOT's EMT, AEMT, and paramedic courses compare. Each has its own scope and purpose, and understanding those differences is key as you step into the world of EMS. And finally, we talk about EMS as a system. Chapter 1 focuses on the big picture, the key components that make EMS work as a coordinated life-saving network. By the end of this section, you'll see how everything fits together and where you play a role in it. We start by breaking down the EMS system. It's not just ambulances and lights, it's a team of healthcare professionals working together. Their goal? To provide emergency care and safe transport for patients who need it most. And here's the important part, the entire system is governed by state laws. These laws outline how we operate, making sure care is consistent and regulated. Now let's talk about the certification process. Once you complete this course, you'll be ready to take your certification exam. Depending on where you live, that could mean the National Registry of EMTs exam or your state-specific test. Passing this exam is your next big step. Once you're certified, you can apply for state licensure. Licensure is how states ensure you're competent to provide care. It's like their stamp of approval. By managing who's allowed to function as a healthcare provider, states make sure patients get the highest quality of care possible. This process ensures that by the time you're out in the field, you're fully prepared to step into the role of an EMT. Let's keep moving. Let's talk about the 4 levels of EMS training and licensure. Each one builds on the last, giving providers the skills and knowledge they need to handle more complex situations. The first level is the EMR, or Emergency Medical Responder. EMRs are often the first on scene. Think firefighters or police officers. Their job is to provide basic, immediate care to stabilize patients until more advanced help arrives. Next up is the EMT, or Emergency Medical Technician. EMTs make up the backbone of EMS. They provide essential emergency care like managing airways, performing CPR, and transporting patients to the hospital. Then we have the AEMT, or Advanced Emergency Medical Technician. AEMTs can do everything an EMT does, but with some advanced skills, like starting IVs, administering certain medications, and managing more complex situations. Finally, there's the paramedic. Paramedics are the highest level of pre-hospital care providers. They handle advanced procedures like intubation, cardiac monitoring, and administering a wider range of medications. Paramedics are trained to handle the most critical and life-threatening emergencies. Each level plays a unique role in the EMS system, and tonight we'll give you a deeper look at how these roles work together to save lives. Let's break down how the EMT course works. There are 3 main types of learning activities: and each one is designed to build your skills step by step. First, there's reading, lectures, and discussions. This is where you lay the groundwork. You'll read to get the facts, listen to lectures to understand the big picture, and join discussions to dig deeper and ask questions. This part helps you understand not just what to do, but why you're doing it. Next, we have skill labs. These happen at the end of each module and give you the chance to practice the skills you've been reading about in a controlled, low-pressure setting. It's your time to work through the steps, ask questions, and even make mistakes, because this is where you fine-tune your technique without any real-world consequences. Finally, you'll move on to clinicals. This is the real deal. You'll shadow an active EMS crew during live shifts, applying what you've learned with real patients in the field. These clinicals typically happen either at the end of the course or right after each skill lab. They're a critical step in transitioning from the classroom to real-world practice. By the end of this course, these 3 learning activities will work together to prepare you for the challenges of emergency care. Let's talk about the focus and requirements of EMT training. EMTs are often called the backbone of the EMS system here in the United States, and for good reason. They're the ones who respond to the majority of emergencies, providing critical care when it's needed most. As an EMT, your primary role is to deliver emergency care to people who are sick or injured. Whether it's a broken arm, chest pain, or a life-threatening trauma, you're trained to assess the situation, stabilize the patient, and transport them safely to the hospital. The training you're about to go through prepares you for these challenges. It gives you the skills and confidence to step into emergencies and make a real difference in someone's life. So, as we move forward, keep in mind that you're training to be a vital part of the EMS system, a role that millions of people depend on every single day. Let's go over the licensure requirements for becoming an EMT. While specific requirements vary from state to state, there are some general steps that most states follow. To start, you'll need a high school diploma or equivalent and proof of immunization against certain communicable diseases. You'll also complete a background check and a drug screening to ensure you meet the standards of public trust. And, since driving is often part of the job, you'll need a valid driver's license. Next, you'll need to successfully complete a recognized healthcare provider BLS course. From there, you'll finish a state-approved EMT course, pass both a written and practical certification exam, and show that you have the physical and mental abilities to perform all the tasks required of an EMT. On top of that, there may be additional state, local, or employer-specific requirements to meet. The Americans with Disabilities Act, or ADA, is also important to know about. It ensures that people with disabilities aren't denied access to state or local EMS programs or employment opportunities. Employers are required to make reasonable accommodations to give individuals with disabilities a fair chance at employment. This means modifying the work environment or adjusting how a job is typically performed to ensure inclusivity. Lastly, your personal background matters. States have varying rules about criminal histories, and some offenses, whether misdemeanors or felonies, may prohibit individuals from becoming EMS providers. These requirements are in place to ensure that every EMT is prepared, capable, and ready to provide high-quality care in the field. Let's take a step back and look at how the EMS system we know today came to be. As recently as the 1960s and early 1970s, emergency care across the United States was all over the map. There was no standard system, and the level of care you received depended largely on where you lived. The turning point came in 1966 with the publication of Accidental Death and Disability, the neglected disease of modern society, better known as the White Paper. This document highlighted just how unprepared the country was to handle emergencies and called for significant changes to improve pre-hospital care. A big leap forward came with the Emergency Services Act of 1973, which provided funding to build better EMS systems. Around the same time, the Department of Transportation, or DOT, published the first EMT training curriculum in the early 1970s, setting the groundwork for what EMS education would become. By 1971, the American Academy of Orthopedic Surgeons released the first EMT textbook, which remains a key resource for providers to this day. Efforts to standardize EMS education kicked into high gear in the late 1970s, with the DOT developing a national standard curriculum. By the 1980s, many systems had expanded to include advanced EMTs capable of providing life-saving procedures. In the 1990s, the National Highway Traffic Safety Administration, or NHTSA, released the EMS Agenda for the Future, a plan to standardize education and provider levels nationwide. This plan was updated in 2019 with the publication of EMS Agenda for 2050, which aims to shape the future of pre-hospital care. The roots of EMS go even further back, starting with volunteer ambulances in World War I, field care in World War II, and the use of medics and rapid helicopter evacuations during the Korean conflict. each step built on the last, leading us to the modern EMS system, a coordinated effort to deliver life-saving care when and where it's needed most. Let's take a look at the levels of training and oversight in the EMS system. These levels, federal, state, and local, work together to ensure consistency and safety in how emergency care is delivered. At the federal level, we have the National EMS Scope of Practice Model. This document sets the baseline for the skills each level of EMS provider should be able to perform. Think of it as the big picture guide that outlines what an EMR, EMT, AEMT, or paramedic is trained to do. While it's not a law, it provides a framework that states use to shape their regulations. At the state level, laws come into play. States regulate how EMS providers operate within their borders. This means that while the federal guidelines set the foundation, states have the power to add their own rules, adjust training requirements, or expand the scope of practice to meet their specific needs. Finally, at the local level, the medical director steps in. The medical director is a physician who provides day-to-day oversight and support for EMS personnel. They're the ones who ensure that the care you're providing aligns with current medical standards and the protocols established for your area. They also play a key role in quality assurance and training. Together, these levels create a system that's both structured and adaptable, ensuring that care is consistent but also tailored to meet local needs. Understanding how they work will help you see where you fit into the larger EMS system. Let's talk about the role of public BLS and immediate aid in emergency situations. Millions of laypeople across the country are trained in BLS, or basic life support, and CPR, giving them the ability to step in and help during the critical first moments of a medical emergency. This training empowers everyday people to make a real difference, often before EMS crews even arrive. One of the most important tools in public hands is the AED, or Automated External Defibrillator. These devices are designed to be easy to use, allowing laypeople to deliver a life-saving shock to someone in cardiac arrest. AEDs are becoming increasingly common in public places like airports, schools, and gyms, making early intervention more accessible than ever. This combination of public BLS training and access to AEDs plays a vital role in improving survival rates, showing how the efforts of trained laypeople and professional responders work hand in hand. Let's dive into the different roles within the EMS system and the training involved at each level. We start with emergency medical responders, or EMRs. These include law enforcement officers, firefighters, park rangers, and ski patrollers. EMR training equips them with the skills to provide immediate care in emergencies and assist EMTs when they arrive. The focus is on basic life support and urgent care with limited equipment. They're often the first on scene, bridging the gap until more advanced care arrives. Next, we have emergency medical technicians, or EMTs. The EMT course takes about 150 to 200 hours to complete and teaches the skills needed to provide basic emergency care. EMTs are responsible for assessing the patient, delivering initial care, and working with other responders to package and transport the patient to the hospital. Advanced emergency medical technicians, or AEMTs, take things a step further. Their training builds on the EMT foundation and includes advanced skills like IV therapy using advanced airway tools and administering a limited number of medications. These additional abilities help them manage more complex medical situations. Finally, there's the paramedic. This level involves an extensive training program ranging from 1,000 to over 1,300 hours of classroom and hands-on internship experience. Many paramedic courses are part of an associate's or bachelor's degree program. Paramedics are trained to perform a wide range of advanced life support, or ALS, skills, including advanced cardiac care, pharmacology, and more. They're the highest level of pre-hospital care providers. Each role plays a vital part in the EMS system, and understanding these levels helps you see where you fit into the big picture of emergency response. Let's take a closer look at the components of the EMS system as outlined in the EMS Agenda 2050. This document sets the vision for the future of emergency medical services, focusing on 5 key components that define a strong and effective system. First, there's comprehensive, quality, and convenient care. This means EMS should provide consistent, high-quality care that's easy for patients to access, no matter where they are or what their situation might be. Next is evidence-based clinical care. Everything we do in EMS should be guided by the latest research and proven best practices, ensuring that the care provided is both effective and up-to-date. The third component is efficient, well-rounded care. This emphasizes making the best use of time, resources, and personnel to deliver care that meets the full spectrum of patient needs: physical, emotional, and even logistical. Then we have preventive care. The goal here is to address potential emergencies before they happen through community education and programs that reduce risks and improve overall health. Finally, there's comprehensive and easily accessible patient records. Accurate, streamlined records help ensure continuity of care by making critical patient information available to healthcare providers at every stage of treatment. These components work together to create a system that's patient-centered, adaptable, and ready for the future of emergency medical care. Let's talk about public access to the EMS system. Getting help quickly in an emergency starts with easy access, and that's why a strong public safety access point is so critical. In the United States, that access point is the 911 system. It's the first step in activating emergency services and connecting people in need with responders who can help. To make the system even more effective, we rely on emergency medical dispatch, or EMD. Dispatchers trained in EMD don't just send help, they also provide life-saving instructions over the phone. Whether it's performing CPR, controlling bleeding, or delivering a baby, these instructions help callers stabilize patients until EMS arrives. Technology is also playing a big role in public access. Today, mobile apps can alert trained laypeople to nearby cardiac arrests. These apps even show the location of the closest AED so bystanders can start care immediately. It's another way technology and public training work together to save lives. Public access is all about bridging the gap between the moment an emergency happens and the arrival of professional care. It's a vital part of the EMS system. Let's talk about human resources in the EMS system. This isn't just about staffing, it's about the people who make the system work. EMS is built on the dedication of the individuals who deliver care in the field. From EMRs to paramedics, it's the people who bring the training, skills, and compassion needed to make a difference in emergencies. The EMS Agenda 2050 emphasizes the importance of creating an environment where talented people want to be. It's about attracting individuals who are passionate about helping others and giving them the tools and support to turn that passion into a rewarding, long-term career. This means prioritizing professional development, creating supportive workplaces, and recognizing the vital role EMS providers play in their communities. After all, it's the people in the system who drive its success and ensure patients get the care they need. Now let's dive into medical direction, which is a critical part of how EMS operates. At the heart of medical direction is the medical director, a physician, who authorizes EMTs to provide medical care in the field. The medical director acts as the vital link between the medical community, local hospitals, and the EMTs in their system. The care you provide is guided by standing orders and protocols. Protocols are detailed guides that outline your scope of practice, describing what you're trained and authorized to do in specific situations. Standing orders are a subset of those protocols. They specify exactly what actions you should take for a particular complaint or condition without needing prior approval. For example, if someone is having a severe allergic reaction, the protocol might tell you to administer epinephrine immediately under standing orders. Medical control is divided into two types. Offline medical control includes standing orders, training, and supervision. It's what you rely on for most situations. Online medical control, on the other hand, involves real-time direction from a physician, usually over the phone or radio. This is used when the situation goes beyond standing orders or requires additional input. Medical direction ensures that the care you provide in the field is consistent, safe, and aligned with current medical standards. It's an essential part of keeping the EMS system running smoothly. Let's take a closer look at legislation and regulation in EMS. Every EMS system, medical direction, and training program has some flexibility in how they operate. But at the end of the day, everything, training, protocols, and practices must align with state laws, regulations, and guidelines. These rules ensure consistency and safety, so care across the system meets the same high standards. Behind the scenes, a senior EMS official is typically in charge of the administrative side of things. This includes scheduling crews, managing personnel, handling budgets, purchasing equipment, and maintaining vehicles. They also oversee the daily operations of ambulances and crews to ensure everything runs smoothly. While your role focuses on patient care, it's important to understand how legislation and administrative leadership work together to support the entire EMS system. This structure keeps everything running efficiently and ensures we can provide the best care possible. When we provide pre-hospital care, it's just the first step in the patient's journey. That care needs to transition seamlessly when the patient reaches the emergency department. This ensures comprehensive continuity of care, where everything you've done in the field is communicated and carried forward by the hospital team. Whether it's providing detailed handoffs, sharing vital signs, or explaining the interventions you've already performed, this integration helps the patient receive the best possible care from start to finish. It's a key part of how EMS fits into the larger healthcare system, working together to save lives. Okay, let's explore mobile integrated healthcare, or MIH, a growing and innovative approach to delivering healthcare. MIH takes healthcare beyond the traditional settings of physician offices or hospitals. It uses the pre-hospital spectrum, delivering care directly within communities. The goal is to improve access to healthcare while keeping it affordable, helping patients get the services they need without unnecessary trips to the emergency room. In the MIH model, care is provided by an integrated team of healthcare professionals. This includes EMS providers working alongside other specialists to address health needs within the community. One exciting evolution in this model is community paramedicine. This approach gives experienced paramedics advanced training, equipping them to offer services that go beyond typical emergency care. These paramedics might perform health evaluations, monitor chronic conditions, collect lab samples, or even administer immunizations, all within the patient's home or community. This shift is helping to redefine what it means to be an EMS provider. By expanding roles and skills, MIH and community paramedicine are creating new opportunities to meet the health needs of patients in ways that are proactive, efficient, and deeply connected to the community. In today's world, technology plays a huge part in how we document and improve patient care. Computer systems are used to record detailed information about each patient encounter, everything from vital signs to treatments and outcomes. This documentation isn't just about keeping records, it's a critical part of ensuring quality care. When this information is electronically stored, it can be analyzed to identify trends, measure outcomes, and highlight areas for improvement. By looking at the data, EMS systems can refine protocols, enhance training, and ultimately provide better care to patients. Information systems are a powerful tool, helping us move toward a more efficient and effective future in pre-hospital care. Quality control is a cornerstone of any effective EMS system, and the medical director plays a key role in maintaining it. Their responsibility is to ensure that care delivered in the field meets established standards and aligns with current medical practices. One important approach to achieving this is through a just culture. This concept promotes a culture of learning, where mistakes are seen as opportunities for improvement rather than just reasons for punishment. At the same time, it holds individuals accountable for their behavioral choices, creating a balance between fairness and accountability. By fostering a just culture, EMS systems encourage continuous improvement while ensuring that everyone, providers and patients alike, benefits from a safe, supportive environment. Another key element of an effective EMS system is continuous quality improvement, or CQI. This process is all about making sure the system is constantly improving and adapting to provide the best possible care. CQI involves regular reviews and audits of the system to identify areas that need improvement. If any issues are found, solutions might include changes to protocols or additional training for providers. The ultimate goal is always to minimize errors and deliver safer, more effective care. One common method used in CQI is the Plan, Do, Study, Act cycle. This approach creates a structured process for identifying a problem, testing a solution, evaluating the results, and making adjustments as needed. It's a continuous loop that helps ensure the system is always learning and improving. Through CQI, EMS systems stay sharp and responsive, ensuring high-quality care for every patient. Patient safety is at the heart of everything we do in EMS, and it requires a team effort between both the agency and the providers in the field. Medical errors can happen for a variety of reasons. They might stem from a rules-based failure, like not following established protocols, a knowledge-based failure, such as misinterpreting a symptom, or a skill-based failure, like improperly performing a procedure. Sometimes it's a combination of these factors. The goal is to minimize these errors by focusing on strong training, clear protocols, and ongoing quality improvement. When everyone works together to prioritize safety, we create an environment where mistakes are less likely to occur and patients receive the best possible care. Let's shift gears and talk about system finance, which plays a crucial role in how EMS operates. The way EMS systems are funded can vary depending on the organization. Some systems are staffed entirely by paid personnel, others rely on volunteers, and many use a mix of both. Regardless of the setup, financial sustainability is key to keeping operations running smoothly. As an EMT, you might be involved in some of the financial aspects of patient care. For instance, you could be responsible for gathering insurance information, securing signatures on documents like HIPAA notifications, or obtaining written permission from patients to bill their insurance companies. These steps ensure the system can recover costs for the care provided. In 2020, the Centers for Medicare and Medicaid Services, or CMS, launched a pilot program called Emergency Triage, Treat, and Transport, or ET3. This program aims to change how EMS is reimbursed by focusing on providing the right care at the right time, Under ET3, payment models now include transport to alternative destinations like urgent care centers or doctors' offices. It even covers treatment on scene without transport, shifting the focus to what's best for the patient while reducing unnecessary emergency department visits. By understanding these financial processes, you'll see how EMS systems are supported and how those efforts tie directly into patient care. Now let's focus on the education systems that shape and support EMS training. In most states, EMS instructors are licensed, ensuring they meet specific qualifications to teach the next generation of responders. Their role is vital in preparing students for the demands of the field. EMS training programs must also follow national standards set by two accrediting organizations: the Committee on Accreditation of Educational Programs for the Emergency Medical Services Professions and the Commission on Accreditation of Allied Health Education Programs. These organizations ensure that programs maintain consistent quality and meet the requirements for accreditation. Even after initial training, an EMT's education doesn't stop. Frequent continuing education, refresher courses, and even self-education tools like computer-based modules or mannequin-based simulations are designed to keep skills sharp and knowledge up to date. These ongoing efforts ensure that providers stay prepared to deliver high-quality care in a constantly evolving field. Education systems are the backbone of EMS readiness, providing the foundation and support for lifelong learning and excellence in the field. Let's dive into the role of prevention and public education in EMS. This is the side of EMS that focuses on public health, examining the needs of entire populations with the goal of preventing health problems before they occur. It's a proactive approach that complements the emergency care we provide in the field. EMS often collaborates with public health agencies in two key ways. The first is through primary prevention, which aims to stop events from happening in the first place. For example, community education on pool safety or proper car seat installation can reduce the risk of drowning or injury in car accidents. The second is secondary prevention, which comes into play after an event has already occurred. Here, the focus shifts to minimizing the effects of the event. Helmets, seat belts, and other safety measures are great examples. They don't prevent accidents entirely, but significantly reduce the severity of injuries when accidents happen. By engaging in prevention and public education, EMS helps improve community safety and reduce the demand for emergency care, creating a healthier environment for everyone. Let's talk about the importance of EMS research and how it shapes the care we provide. Research plays a crucial role in understanding the impact of EMS on the community and finding ways to improve it. It helps answer key questions about what works, what doesn't, and how we can do better. At the heart of this effort is evidence-based medicine, or EBM. This approach focuses on procedures and treatments that have been proven to improve patient outcomes. Instead of relying on tradition or guesswork, EBM ensures that the care we deliver is backed by solid research. To guide decision-making, many EMS systems and states use the National Model EMS, clinical guidelines developed by the National Association of State EMS Officials. These guidelines are built on a thorough review of current research and input from experts in the field. They help standardize care across systems and ensure that providers are using the most effective practices available. EMS research is about more than just data. It's about constantly refining what we do to deliver better outcomes for the patients and communities we serve. Let's dive into the roles and responsibilities of an EMT, which go far beyond simply providing medical care. Whether you're paid or volunteer, as an EMT, you're a healthcare professional with a critical role to play in your community. Your responsibilities start before the call even comes in. You need to keep your vehicles and equipment ready for an emergency at all times. When a call does come, your first priority is always safety. Yours, your partners, the patients, and any bystanders. On scene, you're more than a responder, you're a leader. That means being familiar with emergency vehicle operation, conducting a scene evaluation, and calling for additional resources if needed. Once the scene is secure, you focus on gaining patient access, performing a thorough assessment, and providing emergency care while waiting for additional medical resources to arrive. But it's not just about physical care. You'll also provide emotional support to patients, their families, and even your fellow responders. To ensure continuity of care, you'll work seamlessly with other medical professionals, keeping the focus on what's best for the patient. Beyond the incident, your role includes resolving emergencies, upholding medical and legal standards, and ensuring patient privacy. Your responsibilities extend to the administrative side as well, like completing paperwork and managing reports. And as a professional, you'll be expected to engage in continuous development, building your skills and knowledge throughout your career. Finally, an EMT is a community ambassador. You'll cultivate relationships, educate the public, and give back to the profession through mentorship and leadership. Being an EMT is demanding, but it's also deeply rewarding. Each of these roles contributes to making a real difference in people's lives. Let's shift our focus to the professional attributes that define an EMT. These qualities go beyond skills and knowledge. They're what shape how you interact with patients, colleagues, and your community. First is integrity, which means consistently acting with honesty and adhering to a clear code of ethics. It's about doing the right thing, even when no one is watching. Then there's empathy, being aware of and considerate toward the needs and emotions of others, which is critical in providing compassionate care. As an EMT, you'll need to identify and solve problems without waiting for someone to tell you what to do. Combined with appearance and hygiene, these qualities help you project trust, professionalism, and knowledge to patients and families. Other attributes include self-confidence, which involves understanding your strengths and limitations and knowing when to ask for help, and time management, where you'll balance multiple tasks efficiently while prioritizing safety. Communication is essential too, being able to understand others and make yourself understood. Teamwork and diplomacy are critical in EMS, as you'll be working closely with others in high-pressure situations. Add to that respect, treating others with dignity and valuing their needs above your own, and patient advocacy, where the patient's well-being is always your central focus. Lastly, careful delivery of care emphasizes attention to detail to ensure every intervention is as safe and effective as possible. As a healthcare professional, you're also bound by patient confidentiality. Protecting privacy is non-negotiable, with patient information shared only with those directly involved in care or as legally required, such as with law enforcement or social agencies. This responsibility is taken so seriously that it's federally enforced under the Health Insurance Portability and Accountability Act, or HIPAA, ensuring patients' privacy and trust are protected at all times. All right, let's quickly recap what we've covered in this chapter. We started with the history and evolution of EMS, learning how the system we know today came from a mix of military practices and key developments like the White Paper in 1966 and the Emergency Services Act of 1973. These milestones helped standardize care, leading to the training levels we use now: EMR, EMT, AEMT, and paramedic. We also looked at how EMS operates across federal, state, and local levels, with the National Scope of Practice model guiding minimum skills, state laws regulating operations, and local medical directors overseeing protocols and daily care. Public access, like the 911 system and tools like AEDs, plays a key role in connecting laypeople to emergency resources. Your roles as an EMT are extensive. Beyond providing care, you're a leader on the scene, ensuring safety, managing resources, supporting patients emotionally, and maintaining professionalism. The attributes we discussed, like integrity, empathy, teamwork, and patient advocacy, are critical to earning trust and delivering the highest quality care. We also touched on the importance of prevention, public education, and research in shaping EMS systems, as well as maintaining patient confidentiality under laws like HIPAA. Finally, we covered how funding, quality improvement, and continuing education keep EMS running effectively and evolving. Before we wrap up, make sure you've filled out the attendance form using the QR code on the slide. Also, don't forget to complete any of your assignments that are due by Saturday night at midnight Central Standard Time. Great work so far. Let's keep building on this foundation.